All right, we are back on Myra board. I'm gonna be posting a Myra presentation every Wednesday. I'm gonna be just banging these out. Cycle guides. You know, just general frameworks that I give to my clients that I use myself. This one specifically is going to be about blood work. We'll get to that in a second. But yeah, I'll be posting these up at least once a week, if not more than that, and really just putting out the value for you guys and just telling you how to use steroids effectively and in this video safely. Right. This is going to be probably another long one, so just sit back, enjoy. This is an important one. This is a really important one. I drove to the Indian gas station down the street and got these 6 milligram citrus velos specifically for this video. And we're gonna fucking walk in and we're gonna get started. All right, it tastes pretty good. It's like citrus mint. It's pretty good. Anyways, so this is an important video. It's a really important video. This is how to read your blood work on cycle. So I can't just talk about how to blast steroids all the time, and just fucking go balls to the wall. Yes, it's fun to talk about, and yes, I tell you what is required from a steroid standpoint to bring your physique to the next level, and I help you out in that aspect. But we also need to know how to do it safely. This is an important video. It's probably not going to be like a super fun video, but it's still fun. It's still fun to learn about this shit, right? But we have to learn about this because if you're not getting blood work or you don't know how to read it, you're not going to know what to do to avoid side effects. You're not going to know what to do to to know what compounds to take. You're not going to know like how your body responds to the things you're putting into it. So really important video. So again, this is how to read your blood work on cycle. This is a complete guide for both steroid and TRT users. Before I get too far into this, if you guys have any questions about anything that I outlined in this video, DM me on Instagram at Evan Quinn Fitness. Fingers crossed, we should have the account back soon. DM me YT Blood Work. I answer all my DMs on Instagram, so if you have any questions regarding this video, DM me YT Blood Work, just so I know you came from this specific video. And if you have not watched the video in the description, this is my full step-by-step framework for exactly how to design your steroid cycle. It's the same framework I use to help my clients, and that I just formulated myself over years of using these things and gaining experience. This is everything I've learned ever, and this is exactly how I make my client transformations. It's really going to help you out. So this video will make a lot more sense because you can go watch that video, design your cycle, and then go do your cycle, and then you can refer back to this video and get your blood work when you're on that cycle, right? So it all works hand in hand. So watch the video in the description. Like I said, it's a full breakdown on how to design your cycle, but it's a very, very important video. This is basically it's like the whole framework of everything I do. Everything I talk about in my YouTube, all these guides are basically stemming from that philosophy. So go watch that video. But let's go over a couple things here. So your problem with blood work right now, if you're even getting it, is number one, you just simply don't know how to read it. So you could be getting blood work. If you're non-TRT, you might be getting it on your own from like LabCorp, Anabolic Insights, whatever. Or if you are on TRT, like you go to a clinic, they might actually take it for you every 12 weeks to 6 months. If it's a good clinic, they'll give it to you every 12 months. But you'll get the results back, and they might say, oh, like this is elevated, but they might not really explain it. And you're sitting there reading it and they're like, what the fuck? Like, this looks like another language. Like, I don't even know what to do with this, So, like this is like one of the main reasons why like a lot of my clients work with me. They're like, I don't know how to read blood work. I'm going to pay you to do this because I don't know how to fucking read this, It's confusing. So I'm going to break that down in this video. Number two, you're afraid to see the results because you don't want to stop what you're doing. Okay. So this is like the biggest problem with steroid users. They don't want to get the blood work because they just don't they're afraid to see like what it looks like, and they know things are going to be off, and they don't want to stop what they're doing. They'd rather just live in they'd rather just live in what's the word? Um, they'd rather be oblivious to it. You know, um, they don't want to see it. And if you're taking like trend orals and shit like that, it's like you might just be like, you might be getting like such good results. Like you look fucking insane. Your strength is going up like crazy, but your blood work's gonna look like shit. And you're like, oh no, I don't wanna look at that. I know it's gonna be like shit. I'm just gonna just not get it. But I mean, here's the thing. It's like almost our responsibility to be getting this shit. This is something I do like literally almost every 12 weeks with my clients. I literally assessed 3 lab panels today with my clients that sent them in. And I mean, it's just something that's required, right? And I'm not sitting here telling you I'm the perfect individual, I'm the perfect person, because I mean, when I started using steroids, I did not get blood work, and I was taking some aggressive cycles. I've talked about this before. I've taken 1,000 milligrams of tren. I've taken boatloads of orals. My cycles used to be like lots of tren and lots of orals, and I was not getting blood work. And that was obviously stupid of me. Now I'm smarter. I do my cycles a little bit more, safely and effectively, and I get the blood work so I can assess the data, right? So again, I'm not sitting here and telling you I'm the perfect individual, because I was the same way. I just didn't want to see it. I didn't want to see it. Um, Number three, you don't know what markers to check or what they even mean. So, for example, if you start getting side effects, you don't know like what to even look for. Like, for example, your nipples get sensitive, or you have low libido, or you're getting lethargic, and you don't know like what to look for specifically in terms of like what could be elevated. You're experiencing side effects, and you want to check to see what's going on. Again, just going back to what I just said, you could be experiencing some negative steroid related side effects, and you just want to see like, okay, like, what is going on here? Like, what do I need to bring down? Like, what is a good indicator of me reducing the side effect, so when I get my lab panel next, I can see if it's back in range, right? If that marker is back in range. So here's the problem with most doctors nowadays. A lot of them, so if you go to like a general practitioner and they just give you like a basic panel, they don't have steroid knowledge. They don't have knowledge of, like bodybuilders, right? Bodybuilders are like a whole nother demographic, because we have more muscle than the average person. We train really hard. We eat a lot of protein, and we take steroids, obviously. So yeah, they just lack just general knowledge of PEDs. They have like a Google search knowledge of this stuff. It's like some of the shit I hear from general practitioners is like you literally just search that on Google and just regurgitated whatever was on the front page. Like, it's obvious. It's like they just have like a very general surface level knowledge of the stuff. So for example, like they'll say, oh, your total, like if you're natural and you get your levels checked, like your testosterone levels, they'll be like, oh yeah, your total testosterone is at 300 nanograms per deciliter. Good to go. Yep, you're healthy. But meanwhile, you have depression, low libido, and you can't build muscle. And you're like, fuck, like that's doesn't sound right. But the doctor says I was in the reference range, so obviously I'm good. But no, that's not how it works. 300 is still very low, like clinically. And for example, if you're on TRT, they might see your total testosterone is at 1,500 nanograms per deciliter, which is outside the reference range. And they'll be like, oh, whoa, too high testosterone. We got to bring you back down and lower your TRT dose. But then you're like, no, fuck, what the hell? I feel great. I'm building muscles. Like, so I've literally heard this from clients that I work with today, that they're working with TRT clinics that would literally lower their dose if it got too, if the reading on the blood work, the total testosterone reading on the blood work got too high. So if your LDL is slightly elevated, they'll be like, oh, nope, take a statin. You're read a prescription, take a statin without even asking questions. Oh, but like, no, I'm taking this. Nope, here's a statin. Nope, here you go. Shut up. It's literally what they do. Liver enzymes are up. Yep, stop drinking. Stop drinking. Oh no, but I trained the other day. I just did like really intense training, and my AST and ALT are elevated, and I've been sober for 20 years. No, just stop drinking. It's like, these are the answers that they literally fucking give you. So again, they just give you basic prescriptions and refer you out if things are elevated, but they do not give you practical advice on what to do for bodybuilders using steroids or TRT. Okay. So this is the problem. So here's what you actually need to know. Is my free and total testosterone high enough for my goal? Is my estrogen in range for overall well-being and building muscle? Some of my health markers are out of range, but is this acceptable for being on cycle or unacceptable? Because a lot of the reference ranges on these general panels are designed for general population that eats like shit, doesn't train, and doesn't take steroids, and doesn't have muscle. They have a low muscle mass. So obviously, if we are in this extreme demographic over here that takes steroids, has muscle mass, and trains really hard, some of these markers are going to be a little bit outside. So is it acceptable to be outside or is it unacceptable? Right. So that's what I'm mainly going to go over in this guide here. And how do I keep my markers actually in range while on cycle? How can I mitigate issues before they become issues? All right. So excuse me. Gotta like take a sip of water. I'm like, my mouth is so fucking dry right now. Probably gonna have this fucking velo in my mouth. All right. So what this guide gives you, every marker explained in simple language so you understand. Simple language. I'm not going to confuse you. Okay. This is going to be very simple to understand so you can implement this, get your next lab panel, and understand what's going on. Okay. I'm going to tell you acceptable ranges for PED and TRT users. Okay. So if something's out of range, I'll tell you whether to be alarmed or whether you can just chill and be like, nope, this is because of this. I'm going to tell you what causes each marker to be off, the exact reason. I'm going to tell you exactly what to adjust if something is off, because obviously the reason you're watching this video is, okay, that's great, I know how to read my lab work, but what happens if something is elevated? Like, what do I even do? So the panel you need, and these are just like a few markers. Obviously, when you get a full comprehensive panel, they're going to take way, way, way more than this. Okay. And if I sit here and break down, because I'm going to go into like each marker in detail down here. If I sit here and break down every single marker on these panels, I'm going to be sitting here for fucking 3 hours. So I'm going to tell you the markers that you do need. I'm going to go over the ones that you specifically want to understand and look out for as somebody that uses TRT steroids and goes to the gym. Okay. So hormonal, we want free testosterone. We want total testosterone. We want estradiol, a sensitive assay. I'm going to go into why that is in a little bit. LH and FSH, so luteinizing hormone and follicle stimulating hormone, prolactin, and SHBG, sex hormone binding globulin. So for liver, we want AST, ALT, GGT, total bilirubin, and alkaline phosphate. For kidney, we want BUN, creatinine, EGFR, uric acid, and cystatin C. For cardio, we want a full CBC. So that's going to be including like red blood cell count, hematocrit, hemoglobin, platelet count, white blood cell count. There's basophils, there's so many more. So specifically hematocrit, hemoglobin, and RBC. Those are the ones that we really want to look out for. Total cholesterol, LDL, HDL, triglycerides, apolipoprotein B, or ApoB for short. This is for cardio. And other general panels we want to get, or general markers, prostatic specific antigen. That's a mouthful. For men over 40, or even anybody in general who's taking gear. Thyroid stimulating hormone, free T3, free T4, fasting glucose, HbA1c, IGF-1, and C-reactive protein, high sensitivity C-reactive protein. Okay, and now I'm going to go into essentially each of these categories, and I'm going to tell you like the markers that you need to know, the ones that are the most important for you to know and understand, and how to mitigate problems. Okay, because again, if I'm breaking down every single marker on these panels, I'm going to be sitting here for 3 hours. I'm going to bore you guys, so I'm going to tell you the ones that you need to know. Let's go over hormonal first. This is really important. So, free testosterone. This is essentially the active testosterone that is available to bind to androgen receptors. And this is more important than total testosterone, because you could technically have a total testosterone level of, let's say 4,000 nanograms per deciliter, but you could only have like a little bit of that freed up for use to bind to androgen receptors. And if that's the case, that's a problem. That would indicate a high SHBG, and you need to bring that down to free up more testosterone to be utilized. So the range, so just the normal lab reference range is anywhere from 9 to 30 picograms per milliliter. And the enhanced target, so somebody that uses steroids or TRT, we want to be around 30 to 60 picograms per milliliter. If it's too low, that means not enough active testosterone is in you despite being on cycle. So a lot of your testosterone is unable to be used. So if that's the case, you want to check your sex hormone binding globulin, which I'm going to go over in a little bit right here. I'm actually going to go over that next because that relates to this a lot. You want to check this and make sure this is not elevated. This is really interesting, and I'm going to go over this when I go over SHBG, but Proviron and other orals can actually free up a lot of bound testosterone. So this is why when I talk about like Masteron and Proviron, they don't like directly build muscle, but they indirectly build muscle by allowing your more of your testosterone to be used and freed up for use for like muscle building. And just like a note for both free and total testosterone, it's always like best when you're taking these panels in general, just to get your lab test before your next injection, not the day of. I mean, if you inject every day, it's a different story. But if you inject like 3 times a week, for example, like take it before your next injection. Like don't inject in the morning and then take your panel because that could skew some things. And you'll get the most accurate reading doing it that way. All right. So total testosterone. This is the combined measurement of your testosterone, both free and bound. So that's like the number that everybody loves to just showcase when they get blood work. They'll take their cycle and be like, oh, look at my testosterone. It's 5,000 nanograms per deciliter. But then, like I said, a lot of it could be bound up and you could just be doing something stupid with your cycle, or something could be like fundamentally wrong, right? So just like the normal reference range for total testosterone, this would be like something that's natural. So anywhere from 260 to 900 nanograms per deciliter. So low end, high end. Like this is what I was talking about before. Like this reference range is fucking retarded, because a general practitioner that does not have steroid knowledge or hormone knowledge could look at this, could look at somebody with clinically low testosterone and symptoms of low testosterone and see a reading that's like 270 and be like, no, you're good. You're in range. We don't need to give you TRT. But they have low levels and they feel like shit. So the reference range is just retarded. But okay, let's go into what we actually need to know, because a lot of us are taking gear. So if you're on TRT, this is going to be around 600 to 1,000 nanograms per deciliter. So 600 would be like kind of on the low end. I mean, it depends. If you're just trying to get back to like just baseline level, like 600 to 700, like for like normal function is okay. And that would be like a pretty low level of testosterone they're giving you. They'd probably give you like 100 to 150 milligrams per week of testosterone to get you in that range. And ideally they just want to get you back up to, like high normal, like 1,000 nanograms per deciliter. And then on cycle, depending on how much testosterone you're taking, this is gonna be anywhere from 1,500 to 3,000 plus nanograms per deciliter. Okay. So with the total testosterone, this is like an indicator that I like to look at if I'm working with somebody for the first time and they're taking gear and they're not really getting the results that they want from it. Obviously it could be a diet and training thing, but a lot of times it is, but it could even be like an underdosed gear issue. So I'll take a look at their total testosterone. If they're taking like 700 milligrams of testosterone per week and their total testosterone is only at like 1,500, okay, that's an indicator that your testosterone is probably underdosed and we need to switch your source. So like I said, total testosterone can be high, but free can be low due to elevated sex hormone binding globulin. Total testosterone does not always tell the full story, which I just explained. So I'm going to get into SHBG because it relates to this whole thing. So the SHBG, so sex hormone binding globulin, this is the protein that binds testosterone and renders it inactive. So a high SHBG reduces the effectiveness of your cycle even at adequate doses. So this can be high for a couple of reasons. Sometimes it can be due to the genetics. Sometimes it can be due to, mostly genetics. mostly genetics. Just kind of like how you respond to the testosterone that you're injecting. Um, and I mean, this can literally just like a lot of times can make or break your cycle. So we have to take a look at this. Um, Typically want to be in the range of about 10 to 57 nanomoles per liter. Um, and if you have a high SHBG, that means more of your testosterone is bound and unavailable for use. So like I said, it does not matter what the total number is. If this is all locked up and bound, it cannot be used to build muscle. So this is really interesting. Proviron has the highest SHBG binding affinity of any steroid. This frees up active testosterone significantly. So I would say Proviron and Masteron do this really well. So for example, if you are taking, let's say like 1,000 milligrams of testosterone solo, and you want to add like a little bit of firepower to your cycle, that won't be super toxic and just makes your cycle work better. A low dose of Proviron, anywhere from 25 to even like 75 milligrams per day, can really help just improve the effectiveness of your testosterone. Um, Most orals do this too. Any oral like Winstrol, Anavar, Anadrol, they'll all do this to some extent as well. So it's just a plus of taking orals too. They just make your testosterone work better. So let's go over the female hormones, the ones that are the cause for a lot of side effects in cycles. So let's go over estradiol. So this is the primary estrogen in men that we want to be taking a look at. This is the type of estrogen that causes the majority of side effects and the one that we want to keep in range. So optimal range for enhanced users is going to be anywhere from 20 to 50 picograms per milliliter. And it can be higher and lower due to or depending on the individual sweet spot. So everybody has their estrogen sweet spot that they operate the best in. So from myself looking at, like probably hundreds of blood panels at this point, like I sometimes see people are way outside that reference range. We're talking like 70 to 80, and they have perfect libido. They have no water retention. They have no acne, no gyno, and they feel great. But other people could be outside that range and feel like garbage and get all the estrogen side effects on the planet. And then vice versa. People could be on the low end and feel good. Some other people could be on the low end and feel like shit. So if it's too high, you'll get water retention. So these are like typical high estrogen side effects to look out for. So you get water retention excessively. You'll get brain fog, sensitive nipples, mood swings, libido issues. So like erectile dysfunction or like just low sex drive in general, acne, and prostate swelling. The prostate swelling isn't always from DHT. It's a lot of times it is from elevated estradiol. You might find if your estrogen is high, if you're taking a lot of testosterone or some D-ball, it might be a little bit harder to pee, or like you have like a weak stream. You'll have like a more frequent urge to urinate, and that can be a lot of times from high estrogen. So to fix this, you can either lower your test dose, you can add in some Primo, Masteron, or EQ. These three do a really good job at controlling estrogen systemically. I'd say EQ does it the most, and then Primo, Masteron are pretty similar. Or you can throw in a low dose of AI. In my opinion, I would do the Primo Mass EQ first, because not only are these going to be, not only are they going to act as AIs in the body, but they're going to help you build muscle and they're anabolic. So, I mean, we're getting like the best of both worlds. And they're probably equally, if not less, cardiotoxic as like an AI. And then like worst case scenario, you would just take a low dose of AI. And I'll get into that in a little bit. So if your estrogen is too low, and I've like historically crushed my estrogen so many times to the point where, getting out of bed was like a chore. Like it's like low estrogen is fucking shit. It's terrible. So I personally don't aromatize very much. And this is kind of going back to what I was talking about with the estrogen sweet spot. So for me, I don't aromatize very much. So I could take high dose testosterone with no AIs and no Primo, Masteron, EQ, and I would be completely okay. But for me, if I throw in any kind of AIs, like Arimidex or Letrozole, I'll feel like shit, like garbage. And if I take too much EQ, it'll be the same thing. So some symptoms of low estrogen are going to be, number one, joint pain, low libido. Like this is like worse low libido than high estrogen. It's like your you're basically asexual. It's like getting a boner is literally impossible when you have low estrogen. You'll get extreme lethargy. So like I told you, getting out of bed for me was terrible. Like it would just be like I would just be like one foot in front of the other. My feet would feel like they were 100 pounds, like I was dragging cinder blocks. It was terrible. You got poor muscle building and kind of like flat feeling muscles because estrogen is actually required for glycogen synthesis. So you'll go pretty flat when you have crushed estrogen. So the fix to this would be reducing or eliminating any AI use. So if you're on TRT right now and you're getting any of these symptoms or all these symptoms, and your clinic is just throwing AIs at you like they're fucking candy, just take them out and see what happens. Like not everybody needs them. Okay, there's never going to be like a set amount of Arimidex that everybody has to take per testosterone dose. No, it's going to be completely individual. The way I actually the way I handle this with my clients is I actually don't start them with any aromacin dosing. I just have them have it on hand. And if they run into side effects, for example, like some nipple sensitivity or some libido issues, I have them take a small dose of aromacin, 12.5 milligrams, and I have them wait a couple hours and report back to me. And usually the symptoms go away. So we take it on a case by case basis. We don't just want to slam it, like just because we don't want to take it for the sake of taking it, if that makes sense. So number one, reduce or eliminate AI use to fix the low estrogen problem. You can raise testosterone if you're taking Primo, Masteron, or Equipoise, because you have to kind of like find the proper ratio for your body. It's like it's gonna be different for everybody. There's no like just like I was talking about with the Arimidex dosing. There's no set amount of Arimidex that everybody has to take, and there's no set ratio of test to EQ or test to Masteron or test to Primo that everybody has to take. It's going to take some experimentation. So you can raise your testosterone. You can lower your Primo Master EQ dose and find your sweet spot ratio, or you can add in small dose of Dianabol. You know, if you're already taking an oral and you feel like pretty shitty, like you're getting crushed estrogen, you can swap out your Anadrol for a low dose D-bol, and you'll probably feel better. So, like I said, crashed estrogen is way worse than raised estrogen, way fucking worse. And just a small note. So, get a sensitive assay test when you're assessing estradiol. So, other steroids like trenbolone and nandrolones, they can register as estrogen on a normal test. But if you get a sensitive assay test, they won't. It'll just be from your testosterone. So, for example, if you are taking trenbolone and you get like a normal estrogen test and you have no symptoms of high estrogen, and all of a sudden you get a reading and your estrogen is in the triple digits and you start freaking out, that's okay. All you need to do is just get a sensitive assay test and it's probably going to give you an accurate reading. And like I said, the rates of aromatization are person to person. Aromatization meaning the conversion of testosterone to estrogen. So it's going to be different for everybody. So AI usage and Primo, Masteron, EQ to testosterone ratios will all be different for everybody. There's never going to be one set in stone rule for everybody. It's going to be different. All right. We're already at 30 minutes. This video is going to be long, so sit tight. But this is all important. Prolactin. Let's go over prolactin. So this is going to be elevated by nandrolone and trenbolone, and some generic HGH brands will do this too. I've experienced this taking generics. I've had elevated prolactin. Once I switched my source, I was okay. But nandrolone and like Deca, NPP, and trenbolone will do this. So just real quick. So prolactin is this is like the hormone that females produce when they're pregnant. So it's also the hormone that you produce when you ejaculate. And you know this. So when you ejaculate, you don't feel like having sex after you ejaculate. You kind of feel like a little bit tired and like lethargic after you do it. And then you kind of bounce back after your levels go back to normal. So just imagine the hormone you produce after you ejaculate and the feeling that you feel after you ejaculate just sticks with you all the time. that's going to be a problem, right? So your body's essentially in a state as if you like just ejaculated all the time. It's not fun. Um, so this is rarely an issue without the use of these 19-OR compounds, like nandrolone and trenbolone. But these two are notorious for it. So proper range to be in is going to be anywhere from 2 to 18 nanograms per milliliter. And if it's too high, like I said, you have low libido, sexual dysfunction, and you could have like a hard, tender tissue formation under your nipple. So this is prolactin-based gyno. So the gyno from estrogen. This is just a quick side note. The gyno from estrogen is more like sensitivity and burning. There's not. It doesn't necessarily form like a hard lump immediately. It's just sensitivity and burning. It's very noticeable too. Um, versus the prolactin gyno, it doesn't give you any sensitivity and burning like initially. It's like a slow, tender buildup. You'll find like maybe a year or 2 years later, you'll find that like you'll just have like this like tender lump. I even have one right now on my right nipple from because I used to use a lot of trenbolone without controlling my prolactin. So I'm paying the price. I'm probably gonna have to get it removed in a couple of years if it gets worse. But it's a lot different. It's like it's hard and it's tender. So the fix, discontinue nandrolone or trenbolone if it's like really a problem. Like you just find another compound. Like for example, if DECA and NPP are giving you problems, switch to EQ, switch to Primo. There's not one way to build muscle. Some people just don't like being on those compounds. And if it's really bad and you want to continue using trenbolone, you can take some cabergoline, anywhere from 0.25 to zero point 0.5 milligrams 2 times per week. I wouldn't exceed 1 milligram per week of cabergoline because it could be cardiotoxic. But this is a compound I have everybody have on hand, all my clients, like when they're taking trenbolone. I have them just have it in the toolbox in case they run into any problems. All right. So that's those are the hormonal markers. Let's go over the liver markers. So if you're taking orals, um, this is going to be very important for you. Okay. Let's go over AST, ALT. So your liver enzymes. So AST, ALT liver enzymes. So these are the primary indicators of liver stress, and these are elevated by oral steroids. This is expected when taking orals other than Anavar and Proviron. So Anavar is processed mainly through the kidney, not the liver. I made a whole video on Anavar before. You can go and watch it. Processed through the kidney, not the liver. So you won't really get elevation of these unless you're taking high doses. And then Proviron isn't even processed in the liver. Or I mean, technically all steroids are, but it's like they won't cause like liver stress. So these two are okay on the liver, but Superdrol, Anadrol, D-bol, Winstrol, Turinabol, Halotestin are all very stressful on it. So AST you want to be keeping around a 10 to 40. I don't fucking know. Forgive me. I don't know what that measurement is called. U dash L. Um, I'm stumped on that one, so forgive me. Um, we'll call it U dash L. Okay. Um, so ALTC. I'm not sitting here asking like I'm all knowing, guys. I'm not sitting here acting like I'm all knowing. I've done this stuff for years. I don't know everything. Okay. I just done a quick Google search, but who knows? Anyways, ALT, we want to be keeping around a 7 to 56. And so acceptable if you're taking orals is going to be anywhere from 2 to 3 times the upper limit. And this is like manageable on orals if you're taking anything like Tudka or NAC. You should be taking these anyways, like regardless if you're taking orals or not. But you can pretty much maintain like a higher liver enzyme count for the length that you're running the oral, because once you come off the oral, it's going to come back to normal. But if you're at 3 times the upper limit, that's going to be concerning. And this is probably when you're going to experience some liver toxicity. So some signs of liver toxicity that nobody really talks about so much. I don't really hear so many people talking about these. But it's going to be extreme lethargy. Like for example, it's like you'll get so fatigued when you take the oral, like hours after you take the oral, it'll be like massive fatigue. Your face will get all flushed up, and it's like you'll try to drink caffeine, but the caffeine won't really do anything. it's like that's a sign of liver stress. You'll get bloodshot eyes. It's like the whites of your eyes will become like red and almost like bloodshot. When I was taking my oral heavy cycles when I was first getting into bodybuilding, that would happen to me a lot, and I would kind of brush it on the table. I wouldn't even know what it was until I did more research on this. Um, and you also get a loss of appetite. Orals are notorious for just crushing your appetite, so that's why I don't necessarily recommend them when people are doing growing phases, because they're just too toxic. And if you can't eat the food, you're not going to grow. And the fix, pretty simple. Just especially if you're experiencing these issues, it's probably time to come off the orals anyways. So discontinue or reduce the oral dose. Um, Add in TUDCA 500 milligrams daily, NAC 600 milligrams daily, and or glutathione injections 600 milligrams 3 times per week. Glutathione injections are a very underrated liver support agent. Um, you should, I mean, I have my clients take this. A lot of times, like, if I have a client that gets sick a lot, I usually have them take glutathione injections, because I mean it's a very strong antioxidant as well. But if you're taking orals, this can just help you just almost like extend the run that you can take them. Um, so just stuff for you guys to know. I mean, TUDCA and NAC you should be taking anyways, but glutathione if you're taking orals is very powerful and underlooked. So just a quick note. So oral cycles should not be longer than 12 weeks, and the markers will return to normal when the oral use discontinues. So the liver regenerates very quickly. The reason for that is the liver regenerates very quickly. Other tissues don't, liver does. Um, Once you remove the catalyst being the oral. So this is really key because a lot of you guys train hard. Um, you go to the gym, you beat the shit out of your muscle tissue, you break it down, and then what happens is you produce muscle protein breakdown waste products like lactic acid and some other things which are processed through the liver, which can cause some elevation of AST ALT. So if you get a blood panel, like let's say you train legs in the morning, you do a killer fucking leg workout, and then you get your blood test the same day, yeah, you're gonna have some elevated AST ALT. If you have an unknowing doctor, they're gonna think you're going through fucking liver stress. It's that much. So the best indicator I'm gonna talk about GGT in a second because that actually relates to this a lot, but it's not always the best indicator of liver stress because we go in the gym, we train, we break down our muscle tissue, and we produce waste products. So Anavar, even at high doses, does not cause significant elevation of AST ALT, like I was talking about. And if you want to learn more about Anavar, I made a whole video on it last week. Go back and watch it. But no, it's processed through mainly the kidney, not the liver. So you can take pretty significant doses, like 50 to 75 milligrams. I've had clients that have taken Anavar at those doses, and I'll look at their liver enzymes, and they're completely okay. All right, so GGT. This is a much more specific marker of liver function than AST ALT enzymes because these are completely unaffected by muscle protein breakdown byproducts. So, for example, if you have elevated AST ALT, but your GGT is normal, then the source is muscle breakdown and not the liver. So it makes sense for this demographic. Guys that go to the gym and train hard and have a good amount of muscle mass, right? And if they're both elevated, this points to liver stress. Okay, and acceptable range here. Forgot to go over that. 9 to 48. Again, U-L. Forgive me, I don't know what that means. Don't know what that means. Got to keep it raw and real for you guys. If I just act like I know everything, then I'm just gonna come off like all these other guys on the internet. So can't know everything. Kidney markers. So I put this in orange because this is going to be the color of your pee, of your urine, when you have kidney stress, right? So hopefully it doesn't get that bad. Hopefully it doesn't get that bad. Let's go over creatinine and EGFR. These are really important. So this is the primary marker of kidney filtration, especially EGFR. EGFR stands for estimated glomerular filtration rate. So that's your kidney's rate of how it filters blood. And this can be affected by muscle mass, protein intake, and intense training. So just like with the AST, ALT liver enzymes, these can be elevated by intense training because not only are those protein breakdown byproducts processed in the liver, they're also processed in the kidney as well. And if you have higher muscle mass than the average person and you eat a high protein diet, like anywhere from 250 to 400 grams of protein per day, which a lot of you are eating, this can be elevated. So creatinine, acceptable range is going to be anywhere from 0.7 to 1.3 milligrams per deciliter. And then EGFR, we want to be staying above a 60 milliliters per minute, 1.73 meters squared, I believe. I think if I remember high school math enough, then that's what that is. All right, so some context here. So steroid and TRT users eating a high protein diet will have elevated creatinine that looks abnormal but is often not an issue. And you would get a cystatin C test for full assessment. I'm going to go over that in a second because it relates to this a lot. But this is almost always going to be elevated. So if you see this elevated on a panel and you're freaking out a little bit, you just get a cystatin C test and really see the full story. This is why a lot of times when I'm looking at kidney function with my clients, I'm looking at the full story, and I'm understanding of, okay, like this demographic trains hard, eats high protein, and has muscle mass. It's like so concerning would be like if it's anywhere from like 17.2.0 or 17 to 2.0 combined with an elevated BUN and combined with declining EGFR and combined with high cystatin C across multiple panels. This would require attention. So kidney function is one of the main things I look for when I go over clients' blood panels, because the liver regenerates very quickly. After we stop the oral and we reduce the liver stress, the kidney is going to regenerate. After we stop the orals and everything like that, the liver regenerates. Liver regenerates very quickly. The kidney does not. So if you have kidney stress for a long period of time, that will not regenerate as quickly, or if at all. So this is what we want to be keeping high function. So statin C. So this is a protein that is produced at a constant rate and is filtered exclusively by the kidneys. And this is completely unaffected by muscle mass, protein intake, or intense training. So just like when we would assess GGT along with AST, because this is going to be affected by training and GGT is not, same thing for kidneys. This is affected by training and muscle mass. This is not. So the range would be anywhere from 0.52 to 0.9 milligrams per liter. And the reason this matters is creatinine is pretty unreliable for kidney function, basically for jack guys eating high protein, which is a lot of you. Okay. Cystatin C is a much better indicator of kidney function for this demographic. If creatinine is elevated, but cystatin C isn't, it's diet and training related. Okay. So if you get a creatinine out of range and you just hit a leg day like 2 days ago and you see it elevated, it's not really much of a concern if your cystatin C is okay. If both are elevated, then attention is required. So who would need to get this? I mean, you should be getting it anyways, but specifically who needs to get this if you're using Anavar, because it's processed by the kidney. So we're taking high dose Anavar, 75 to 100 milligrams, should probably be checking this. Anyone using aggressive stacks. So if you're really taking things to the next level, using, 1,000 test, trenbolone, orals, stuff like that, definitely get that checked. And if your creatinine keeps coming back high and you're not assessing cystatin C, but you see your creatinine on all of your panels is just elevated, then get cystatin C. That's what I do with my clients. So for some of their TRT clinics, they don't assess cystatin C. So if I see a chronically elevated creatinine, I'll have them specifically go to a third-party lab and get cystatin C. So BUN, blood urea nitrogen. This is a byproduct of protein metabolism, and it reflects the kidney's filtration of waste. So we want to stay around 7 to 25 milligrams per deciliter. And if you have high BUN with normal creatinine and cystatin C, it's dietary protein intake related. This is almost always related to dietary protein. And again, just like with creatinine, if you have high BUN with elevated creatinine and cystatin C, this indicates a lack of kidney function. Okay, so what do we do to actually control this? So like I said, the kidney is going to be the one of the things we want to be looking out for. This is like the silent killer of bodybuilders. This is the one of the things we really want to be taking a look at. So how do we actually keep this in range? We want to keep blood pressure in range. So how we do this is it's pretty simple. Control water intake or control water retention. But that can be from water intake, controlling insulin levels, doing regular cardio, limit use of compounds that elevate it. So like trenbolone, heavy use of orals like D-bol, anadrol, things that hold a lot of water. Controlling your insulin sensitivity, keeping your body fat low. All those things are going to help keep your blood pressure in range. So if you're constantly just like pumping like thick blood through you, your kidneys are gonna have to filter that. And that's when they go through stress, and that's when they go through degradation. So keep your blood pressure in range, and these markers are going to stay in range pretty much by default. So blood pressure is huge, huge. And it's so simple to check too. Buy a cuff or a wrist monitor from Walgreens, CVS, Rite Aid. Check it a couple times a day. You're good. All right, so cardiovascular markers. Let's go over hematocrit and hemoglobin. So what this measures is basically the red blood cell concentration. So is notoriously raised by high dose testosterone, equipoise, primobolan, and anadrol. So anadrol is actually used in medicine to treat anemia. So it would be, pretty obvious this would raise RBC, hematocrit, hemoglobin, right? If it's, fucking prescribed to fucking have people have more of that, So it's not just the EQ. Everybody thinks it's just the EQ. No, high dose testosterone can do it. A lot of steroids can do it too. Just stuff to look out for. So hematocrit, we want to stay at about 38 to 50%. Acceptable on cycle will be upwards of 52 to 54% because we are taking things that can elevate it. And like I said, there's unacceptable ranges and acceptable ranges. This would be like the high end of what would be acceptable on cycle. And then I would say above 54% is considered pretty high. Then hemoglobin, we want to stay at about 14 to 18 grams per deciliter. So how to fix this? This is actually a pretty easy fix. He's got blood donation. Usually I have my clients get it once every 4 months. If it's over 54% with hematocrit, this will reduce it within days. Double down on hydration. This is like the most underlooked thing when it comes to controlling your CBC markers is just hydration. Like I have literally drank in this almost this whole thing of water when I was making this board, just now. And it's like I was fucking walking to my bathroom and pissing every 5 minutes. But no, double down on hydration. This is the most underlooked thing to control blood viscosity. This is something that not a lot of people know. Reduced vitamin C dose. This can actually help bring your some of your CBC markers down in range. And if you're eating a lot of red meat, for example, if you're eating red meat like 3 times a day, like steak or ground beef, reduce one of your red meat meals and replace it with a lean protein like chicken or fish, just because of the iron content in the red meat, which can actually elevate your RBC a little bit. Not a lot of people know that. And then I would say, like, out of all these compounds, equipoise is going to be like the biggest driver of elevated hematocrit. I mean, the other compounds do it, but equipoise notoriously does it the most. Actually, I had a client give me his lab work today, and he got his lab work after taking equipoise, and I think he took 2 shots of it. So he wasn't even on it for like a full week, and he already had elevated hematocrit. So this is something we're going to have to monitor, right? But EQ would be the biggest driver. I haven't even noticed this myself. So yeah, it would be the biggest driver of both hematocrit, hemoglobin, and RBCs. Anadrol, Primo, and high dose test can do this too. let's go over HDL, LDL, and total cholesterol. So this is so HDL is the protective form of cholesterol. So that's quote unquote like your good cholesterol. This one you want to keep high. Then your LDL cholesterol is your atherogenic cholesterol. So that's the type of cholesterol that causes I can't talk today. Fuck. Atherosclerosis. I think I said that right. Okay. So the plaque buildup in arteries. Okay, that would be linked or correlated to that. And all anabolic steroids will suppress HDL to some level. They all will. Every time I see on cycle blood work with my clients, usually they have a lower level of HDL, which comes back to normal when they cruise. So HDL range would be above 40 milligrams per deciliter. LDL will be below 100 milligrams per deciliter. And the worst offenders of this, like the ones that will elevate this the most, will be oral steroids. A lot of them will suppress HDL pretty aggressively, especially Winstrol and Superdrol. These two are notorious for doing that. Trenbolone at any dose will elevate LDL and reduce HDL pretty heavily. Proviron does this, usually lowers HDL pretty significantly. And then testosterone and primobolan seem to be the least harsh on cholesterol. That's why I always tell people running test, primo, and GH is likely the healthiest way to do bodybuilding, and just doubling down on all those three. So how to fix this? Fish oil with EPA DHA, 4 to 6 grams daily. Low intensity steady state cardio 3 to 4 times a week. A lot of you are skipping cardio. Just do your fucking cardio and you will get that back in the range. And get your heart rate up there too. Get your heart rate up to like 130, 150 beats per minute. On cycle, bulking, cutting, whatever you gotta do. Reduce oral and tren dose, or it's eliminated completely if it's an issue. And then niacin at 500 milligrams daily does pretty well. All right. Yeah, like I said, this is going to be a long video, so just sit tight. I thought it was going to be quick, but guess not. We got a lot to go over. So ApoB, which is short for apolipoprotein B. So this is a much more accurate reading for overall cardiovascular health. And this measures the actual atherogenic lipid particles in the blood. So, like I said, it's way more accurate reading of cardiovascular health than HDL, LDL alone. So we want to keep this below about 90 milligrams per deciliter. And you can literally have a low LDL, HDL, but an elevated ApoB. So if you get a blood panel and you see your LDL, HDL is normal and you think you're great, but then you get ApoB and you find your ApoB is elevated, okay, that's a problem. So two guys literally running the same cycle with the same LDL, HDL markers can have an entirely different ApoB level. A lot of the times this does come down to genetics. And a standard lipid panel typically does not measure ApoB, so you usually have to either ask for it or you'll go on like some like Anabolic Insights and hand pick the panel that you get. Not a lot of panels do this by nature. So the fix, pretty much the same thing as elevated LDL, HDL. So fish oil, 4 to 6 grams daily. List cardio. Reduce oral and tren dose. Berberine really helps with this too. This is underlooked. Not only does this help insulin sensitivity and glucose control, this also helps control cardiovascular health, LDL, HDL, and ApoB. So 500 milligrams 2 to 3 times per day. And then low dose rosuvastatin if necessary. So if it's really bad, you can take a low dose statin to help if like nothing else is controlling it. Some of my clients do it, like a very small subset do, but a lot of this can be controlled without actually adding more medication to your stack, just by natural remedies. Okay. All right, and last category here, this gets to be other various markers that you need to be aware of. And a lot of these are really important because they indicate insulin sensitivity, inflammation, all that stuff. So again, really important stuff. C-reactive protein. This is a very underlooked marker, and not a lot of people actually get this, or do they care? So next time you get a blood panel, definitely assess this and check this out, because this is like your key inflammation marker. So this is a marker of systemic inflammation that's produced by the liver. So if you have chronic inflammation for long periods of time, that's what can cause a lot of cardiovascular issues. Um, so you want to make sure that's in check. So this detects low grade inflammation that causes cardiovascular disease and aging. So a normal range would be like below 1.0 milligrams per deciliter. That would be optimal. 1.0 to 3.0 would be moderate risk. And then above 3 is like, okay, you have a lot of systemic inflammation going on and it needs to be assessed. So what raises it? Trenbolone. I've seen trenbolone use, on blood panels when clients take it. That can cause elevated CRP. And usually it's just trenbolone. I've noticed this myself. I noticed this with clients, and what usually happens is when you stop the trenbolone, it usually goes back down. A lot of the stuff can be reversed too. Like once you stop the catalyst, a lot of these things can be reversed. Like your on cycle blood work is never going to look perfect. Just keep that in mind. But trenbolone can cause some inflammation. This is actually really underlooked too. So low quality gear from UGLs, so they can put solvents and all this like shit like to make their oil sterile, because if you have a low quality underground lab that doesn't have the most sterile conditions to make their gear, they have to shove and jam all these emulsifiers and sterilants into their gear, into the oil, to make it sterile so you don't get an infection. But what people don't realize is a lot of that can cause systemic inflammation. So if you don't know why it's elevated, and you're getting this high CRP, and you're taking gear and you feel fine, okay, well, if you switch your source to something that isn't causing the inflammation, because a lot of times if you pin your gear and you have post injection pain and inflammation on the injection site, that's an indicator that something in the gear, you're not reacting well to it. And estrogen in optimal range is cardioprotective. So if you keep your estrogen like right in your body's sweet spot, then a lot of times we can reduce systemic inflammation. So some things fix this. So fish oil seems to be the fix for a lot of these things, and it is. Should be taking this daily. I would say this would be like a corrective dose. Usually what I give to my clients anywhere from like 1,200 to 1,500 milligrams per day. BPC, 500 micrograms daily, really helps. Optimizing sleep. If you sleep like shit, that's like one of the biggest causes of inflammation that people don't even realize. So if you're sleeping 5 hours, 4 hours a night, fix your sleep, and that will come back in range. Reduce body fat, and curcumin, 1 to 2 grams daily can help as well. So PSA, prostatic specific antigen. So this is a marker of prostate health, and this is elevated by DHT derivative compounds like masteron and proviron. These two do it pretty notoriously. Um, and if you are over 40, then this is something you really want to be mindful of. This is probably something your general practitioner assesses just by nature. But if you have below 4.0 nanograms per deciliter, then you're in range. And you ideally want to stay below 2.0 for men over 50. And who tests this? I mean, everybody should be testing this, but specifically men over 40 should be assessing this. And if you have like a rapidly rising PSA across multiple panels, so let's say you get a panel every 8 to 12 weeks, and every panel seems to get higher and higher and higher, okay, that's something you want to be mindful of. If you have a PSA above 4.0, and if you have any symptoms of prostate issues, like for example, frequent urination and weak streams. So if you're taking masteron or you're getting any of these combined with a high PSA, reduce your masteron or take it out completely. Should solve the problem. A lot of people don't realize this too. I didn't want to put this on the sheet because I want people to get the wrong idea, but finasteride can actually help reduce this. Is actually what it was designed for, to reduce DHT binding to prostate tissue. Okay, so fasting glucose and HbA1c. This is really important because this is basically going to be your best indicator of insulin sensitivity. So you hear me talk about insulin sensitivity a lot in my content, how important it is to control body composition, to grow muscle optimally, to be in a fat loss state when you're doing a diet or a cut. So we can actually like assess this on blood work through glucose and HbA1c. So fasting glucose, this is just your current glucose level in the blood, what it is like right now, like a snapshot of where it is right now. But your HbA1c, this is a 3-month average of blood glucose, and this is the best indicator of insulin sensitivity. So people like to say like, oh, like, they take their fasted glucose and that's a good check of insulin sensitivity, which it kind of is. But your fasted morning glucose, if you take it in the morning, that could be, if it's elevated, that could be because you ate your meal late last night, or you didn't sleep well, or maybe you trained really late last night and you still have some sympathetic nervous system stimulation, which can cause some elevation of blood glucose. So there's a lot of things that can elevate it, like just acutely. But your HbA1c is an average of it, so it's a much better indicator. Fasting glucose, you want to be staying around 77 to 90 milligrams per deciliter. Then HbA1c, so below 5.7% is, that's okay. But for optimal insulin sensitivity, you want to be below 5.0. Like 5.0 is pretty good. Usually when I have my guys in like growing phases, I'm really taking a look at this one because we want to keep insulin sensitivity high, for proper nutrient partitioning and body composition control. So if you're on cycle, HGH will raise blood glucose. Usually above 4 IUs will do this. It's pretty noticeable if you have a blood glucose monitor and you start taking HGH. You take it multiple times a day, you'll find it's elevated. You want to monitor this during a growth phase or a bulking phase when you're pushing carbs, because you want to ensure insulin sensitivity is maintained. Because if you're pushing carbs and your insulin sensitivity is fucked, okay, those carbs aren't going to be able to be shuttled into muscle. Okay, you're going to accumulate more body fat and you're going to stop your growth if your insulin sensitivity is out of range. So to fix this, number one would be a lot of this does come down to carb timing as well, making sure your carbs are actually utilized for performance and training and not just sitting in your bloodstream. So timing carbs around training really helps. So you eat your carbs, the carbs are digested, assimilated into your bloodstream into glucose, and then you use that glucose to train, or then shuttle into muscle glycogen. You want to have meals in the day with no carbs, so you extend the insulin sensitivity window. So this would be either your first meal or your last meal of the day where you'd have no carbs, because basically when you sleep, you're not eating for 8 hours. So that's when your blood glucose becomes the lowest and you become the most insulin sensitive. So if you want to extend that time, you can either have a no carb meal before bed or a no carb meal when you wake up, and you've extended that insulin sensitivity window another 5 something hours. Consider metformin or retatrutide if you're taking high dose HGH. Metformin, that's probably like another topic for another video. I don't want to go too far into this because it can help, but again, there's a lot of nuance to it. Retatrutide, again, I've made a whole video on retatrutide and how this can help with the insulin sensitivity with human growth hormone. So again, if you want to go back in my content and watch that video, that will help you understand. And I also made a video on HGH as well, explaining this in more detail. So again, I have lots of content going over the stuff in more detail. You can reduce your HGH dose if insulin sensitivity is lost. So if you're taking like 10 IUs of growth hormone and nothing is really helping control it, you can reduce your dose and you'll be okay. Berberine and cinnamon, 500 milligrams with carb meals really helps as well. This is something I actually have all my clients do, regardless of if they're taking HGH or not. I just have them eat it with all their carb meals just to help them keep stable blood glucose and to help shuttle the glucose into the muscles. And then easiest fix right here, reduce your body fat. If you are over 15% body fat, you will just not be very insulin sensitive, and you'll read your blood panel and you'll have a high resting blood glucose and a high HbA1c. So get your body fat down below 15%, ideally 10 to 12, and try to keep it there as much as you can when you're doing your growth phases, and then that's going to help the most. And then IGF-1, this is produced in the liver in response to growth hormone, and this can't, it's not going to be the end all be all, but it can indicate the potency of your HGH. So a normal range would be anywhere from 115 to 310 nanograms per milliliter, and this will rise in HGH. So how you'd want to assess, just one indicator to assess if your HGH is doing its job besides what you actually see in front of you, like on your body. You can assess anywhere from like 6 to 8 weeks after incorporating HGH. And if there's no rise, then your HGH might lack potency. Again, just one piece of the puzzle. Doesn't mean everything, but just one piece of the puzzle. So if you are not seeing results from your HGH and you're just like holding a bunch of water and feel like garbage and you're not seeing any fullness or benefits from it, and then you find from your blood work as well that your IGF-1 levels are low, then that would indicate your HGH is probably shit. So excessively elevated IGF-1 on its own, that would raise its own concerns. I don't want to get too far into it, but again, that could indicate like a pituitary tumor, something like that, causing like a massive production of IGF-1 levels. So that would be another concern. But again, won't get too far into it. All right. Now, we got through all the panels, or all the markers that you need to be the most mindful of and that are the most important. Okay, the most important for our specific demographic, guys that use steroids or TRT and go to the gym and want to build a lot of muscle. These are going to be the most beneficial, the most important. Now let's actually go into how we can adjust if things are off. So I touched a little bit upon everything in terms of adjustments and fixes in this section, but I'll go over it in a little bit more detail here. So if you're still with me, I know this is going to be probably my longest video right here. We're going to go probably for an hour 30. So if you're still with me, props to you, right? You want to learn. You're right. You're riding along for the journey. I love it. Let's keep going. This is all really important shit. This is all super, super important shit. All right. So number one, what to do if your estrogen is too high. So, is your body fat above 15%? AKA, are you a fat fuck? If the answer is yes, prioritize getting your body fat below 15%. If your body fat is too high, you are a estrogen producing factory. So your body fat like literally just fucking causes like aromatization. Okay? So like if you have too much body fat, more of your testosterone that you inject will be aromatized to estrogen and you will cause problems. So get your body fat lower. That will probably solve it. Like when I work with clients, some of my clients come to me when they're at a higher body fat and they're taking like a certain dose of testosterone and they have to take a certain amount of AIs to control their estrogen. Then when they start working with me and they get lower in body fat, they actually reduce the need for any aromatase inhibitor dosing. Are you running high testosterone? Anywhere from 700 to 1,500 milligrams, if not more. If yes, and your estrogen is high, add in Primo, Masteron, or EQ. Still elevated, add in a low dose Aromacin. This will be like your last ditch effort. So 6.5 to 12.5 milligrams every other day, or Remedex 0.25 every other day. Start at the lowest effective dose. You don't want to crush your estrogen if you're very sensitive to these drugs. So start at the lowest effective dose and then titrate up as needed. This is if you like run into side effects and you get the lab panel and you find your estrogen is like really high. Those would be like the fixes for that. So again, symptoms of high estrogen would be, lack of libido, water retention, prostate issues, acne, gyno, mood swings, all that shit. If your estrogen is too low, remember, this is like the opposite. This is where you feel like fucking shit. You have lethargy, joints aching, no libido, you go flat, feel like garbage. The number one cause of this is people just using too much AIs, and they don't even realize it. So they think, I have to take AIs because I'm taking testosterone. No, that's not how it works. Take AIs as a preventative measure. case-by-case basis. You don't just take it to take it. So if you're using AIs, reduce or eliminate completely. That will probably fix the problem. If not, definitely fix the problem. If you're taking high-dose Primo, EQ, or Masteron, lower the dose or just swap compounds. So if you're taking like a 1-to-1 ratio of test to EQ and you're getting the symptoms of low estrogen, either lower the EQ, increase the testosterone. I'll go over that in a second. Or just swap the EQ for Primo or swap it for Masteron. Maybe not Masteron. If you're trying to grow muscle, Masteron isn't really the best option, but again, different topic. But if you're getting low estrogen EQ, switch to Primo, see if it helps, or just lower your EQ. Still elevated, increase your testosterone by about 100 milligrams. I actually did that with one of my clients recently. We started taking tests in EQ, and we ran, we started at 600 milligrams of test, 500 milligrams of EQ. Started getting some low estrogen symptoms. Adam raised his testosterone by 100 milligrams. Now he's on 700 test, 500 EQ. Now he feels great. He just needed that little boost for a little bit more conversion to estrogen to help his body function. So remove what is suppressing it before increasing your testosterone. So remove the catalyst, either lower the EQ Masteron Primo or lower the AI before increasing your testosterone and see if that works. Okay. So liver. If your liver is 2 to 3 times elevated, liver enzymes, AST, ALT, add in some TUDCA, 500 milligrams per day, NAC, 600 milligrams per day. And you can also add injectable glutathione to this as well, 600 milligrams 3 times per week, like I mentioned before. If liver stress side effects arise, like for example, the lethargy, the bloodshot eyes, and the loss of appetite, if those happen, then reduce your oral dose. If you're taking like 100 milligrams of D-bol and you're getting those problems, along with elevated liver enzymes, then just lower your D-bol to like 50 milligrams. 100 milligrams of D-bol is way too much, in my opinion. So it's reduce or lower your oral dose. If you're drinking alcohol, stop drinking alcohol. You shouldn't be drinking alcohol when you're on orals. Or I don't know. If you're taking injectables, you can get away with it. Orals are a different story. Now, if your liver enzymes are 3 times elevated, at this point, you should probably just discontinue the oral steroids because you're probably on them for too long anyways. Usually they elevate the longer you stay on them. So if you're running orals for like 12 plus weeks, you'll probably find they're going to be pretty elevated. So again, probably time to cut your cycle short. Then TUDCA, NAC, glutathione, like I mentioned before. And then, like I said, the liver will regenerate and remove stress within 4 to 6 weeks after discontinuing the oral. So if this is elevated, it will come back to normal after removing the catalyst. So if your hematocrit is above 54%, blood donation will fix this very quickly. Nattokinase, I didn't talk about this before. Nattokinase, anywhere from 2,000 to 4,000 FU per day. Increasing hydration, like I mentioned before, it's increase it by 1 liter of water, 2 liters of water a day. And if you're running EQ, consider lowering the dose or switching compounds if it becomes problematic. Some people just can't handle EQ from the blood viscosity side of things. Every time they take EQ, it's like they have to donate blood every like fucking 6 weeks. So at that point, it's like when hydration doesn't work, when nattokinase doesn't work, when supplementation, cardio doesn't work, just switch the compound. There's not one way to skin a cat when it comes to bodybuilding. You can use a lot of different compounds to accomplish the same goal. So if you're getting problems from one, you don't have to be married. You don't have to be married to that compound. So if your HDL is below 30 and your ApoB is elevated, then fish oil, 6 grams per day. List cardio, 3 to 4 times per week, low intensity steady state cardio. Eliminate or reduce oral steroid or trenbolone use if you're using those. Berberine, like I mentioned before. And like I said, if it's persistent, consider rosuvastatin. Okay, creatinine. So if your creatinine is elevated and your cystatin C is normal, then that would indicate it is a protein intake, training, and muscle mass related issue. So not really an issue at all. That's just going to be elevated by nature. So if that's the case, if you really want to bring it down, if you're lacking on hydration, increase your hydration by about 1+ liters per day of water. Ensure blood pressure is in range. Um, Things like Advil, Tylenol can elevate this. If you're taking a lot of them, just reduce the dose. And retest with cystatin C on the next test if you're concerned about it. So if you're getting elevated creatinine but you're not assessing cystatin C, I would just get it anyways to make sure everything's good. So if both your creatinine and cystatin C are elevated, this is an indicator of kidney stress, and you do not want to dismiss this. So reduce toxic compound use. So trenbolone, Superdrol, orals, etc. Discontinue those. That should bring it back into range. Increase hydration significantly if you're lacking on hydration. And ensure blood pressure is in check, like I mentioned before. So control with cardio, lowering body fat. Cialis can help at 10 milligrams per day. Telmisartan, if you need to, at 40 to 60 milligrams per day. And hydration. Hydration is fucking key for controlling blood pressure. So blood pressure, like I said, this is going to be the best way you can help control your kidney function. So if your body's just pumping thick blood at a high rate, your kidney has to filter that, and it's going to cause stress. So that's where a lot of that is happening. So if your C-reactive protein is above 3.0, again, fish oil can help. Prioritize sleep. This is like the main reason why people have inflammations, because they don't fucking sleep. So prioritize your sleep. Get 6 to 8 hours, 6 at a minimum. Change your gear source. If you're getting lots of post-injection pain and inflammation from injections, change your gear source, and that'll probably help. I've used gear sources where I would like, this is early on in my bodybuilding. I've used gear sources where my whole arm would get swelled up from taking a shot, and I was a stupid fucking 21-year-old. So I was like, oh no, that's okay. Like it'll go away. But it was happening every injection. If I got my C-reactive protein check back then, it would have been fucking through the roof. So my body was just so inflamed, and it was probably just shit quality oil. So change your gear source. Some people it's with the type of carrier oil too. So some people just have a bad reaction to grapeseed oil, but they have a great reaction to MCT oil, or they have a bad reaction to MCT and a better reaction to cottonseed. So again, just doing a little bit of research and finding a gear source that, number one, has very sterile conditions. Good anecdotal reviews. They're approved on like SST or Meso, and that uses good carrier oils. They don't shove a bunch of solvents in there to try to make up for the fact that they're making the gear in their dirty bathtub. So BBC can help too. 500 micrograms per day can help reduce inflammation. And then PSA, if your PSA is above 4.0, reduce or eliminate masterin or proviron use. Ensure estrogen is not elevated. So if you have like combined estrogen plus combined androgens that are elevated, that can cause prostate swelling. Like I said before, it's not always a DHT issue. A lot of times it can be an estrogen issue as well. And if it's like chronically elevated, even after going down to like a cruise dose, and it's just always high, and you're getting all the symptoms like frequent urination and trouble peeing, that's when you just contact your urologist, and I would just refer you out, because that's not in my scope, right? I'm not a urologist. I'm a bodybuilding performance enhancing drug coach. All right, so this is the last thing we'll go over. And I'll just give you guys a quick kind of like blood work schedule to just a couple like indicators of like when you'd want to assess things and why you'd want to assess them. So basically, it's over the span of about the span of your cycle. So before you go into any new phase, you just want to get a full comprehensive panel. So usually I have guys get the same panel regardless, unless like a specific issue. I'll usually have them get the same panel, and it's on Anabolic Insights. It's the comprehensive male panel, and that has everything we need on here. Everything that I just mentioned plus more. So the purpose of this is just to establish baselines before you change anything. So if you're going from TRT to starting a cycle, you'd want to assess, okay, like let's get a baseline here So when we go on cycle, we can compare and contrast and see if things change. So around week 8 to 12 of any cycle, again, you want to get a full panel, same panel. So you want to assess your response from the gear you're taking. You do this to catch issues early before they become actual, problems that stick with you, and you can make adjustments if needed. So, for example, if you are experiencing some estrogen problems and you find that your estrogen is in the triple digits, okay, that might be an indicator. Okay, it's around week 12 of our cycle. I'm only taking testosterone. Okay, maybe I can add in some EQ as my next compound, and that will bring the estrogen back in a range, and then you don't get those issues anymore. So at around week 16 or the end of your cycle, again, you get a full panel, and you'd evaluate everything before your next cycle and phase. So when I work with my clients, so for example, when we do a lean out phase first, we do like a big dieting phase. So a lot of times if they come to me already taking a cycle, I'll usually have them continue that cycle up until we get down to 10% body fat before we go into a growth phase. So if we get a lab panel at the end of that cycle when they're at 10% body fat, or the end of that phase, and everything looks really good, I might just have them continue and go into a growth phase. If everything looks great, then I'll have them just, I'll definitely switch some things around, but I'll have them continue taking their gear. And if they need to cruise, like if the blood work is completely fucked, then we'll cruise, obviously. But usually if it looks good, then I have them I switch up the cycle a little bit and have them continue. And then, so some like triggers if you want to like immediately pull lab panels. So for example, this would be like for like a targeted specific issue. So if like in the middle of your cycle, doesn't even have to be in any of these time frames here. If in the middle of your cycle, all of a sudden you're getting like really bad issues like lethargy, low libido, all that stuff, you just get like a panel specific for that symptom. So like nipple sensitivity, urination, unusual fatigue, redness in skin, acne, low libido, shortness of breath, just all the stereotypical steroid side effects that you could run into. You'd want to get a panel specifically to address that issue. And you can go back in here and just, see like what issue would, or what panel you'd want to get to address that issue. Okay. So that's pretty much all I got. Yeah, we're at, just like I predicted, at about almost an hour 30. A lot of information here, a lot of really, really important information. So yeah, if you watch the whole thing, now you know how to assess your lab work and what to do so you don't just go into your next cycle blindly. Okay. Lots and lots and lots of value in this video. And again, this is not like a super fun one, like, how to blast fucking Anadrol or fucking how to take Primo or whatever. Like, not as fun, but it's important, really, really important information, because if we are using these things, we have the responsibility to assess our own health. A lot of you are doing this, not to be the biggest, not to be the, not to walk around like a fucking science experiment, like the fucking pro bodybuilders stepping on stage do. A lot of you have families, you have careers, you have businesses, you have other things going on, besides bodybuilding, and you want to be doing this for a long time. So assessing your health is important. So you actually stay in this game and, and live a long, fulfilling life with a better quality because you have a good physique by using these things. So just another way we can do this safely, effectively, and everything like that. So again, that's all I got. Hope you got a lot of value from this video. Again, if you have not watched the video in the description, watch that video. That's going to help you design your own steroid cycle. It's the exact framework that I use for myself and my clients. Really, really valuable video. So just go ahead and watch that, and you can go ahead and design your cycle, do it, and then 8 weeks later, you can refer back to this video and know how to assess your lab work from it. And if you have any questions, DM me on Instagram, Evan Quinn Fitness, YT Bloodwork, so I know you came from this video. If you have any questions regarding anything that I mentioned here. Let's see, what time is it? It's almost it's 1:47 in the morning. So um, give me another late night. So time to go to bed, and that's pretty much all I got. So again, appreciate watching, and I will see you guys in the next one.